Hi, today we will see very important aspect of diabetes care, that is family support in diabetes. Now, today we means inside a consultation room, newly detected diabetes patient and her daughter came. So sugars are around 300, HbA1c around 10, and she was first time detected as a diabetes. She was very much fearful. She didn't have any of the complaints, and she was in a distress, like how can this happen to me? I'm all right, I don't have any problem. My daughter only, she told me to, I have to see the doctor. Now this is the right time, otherwise I will have a kidney problem, heart problem, all my body will have complications. I completely give listening to her. I got her world, her apprehensions, her fear. And daughter was telling, like, she is not eating at all. She has stopped eating. Whatever I give, she will say, no, I have to, sugars are there. I cannot eat this. I cannot eat that. So for the patient's perspective, I counsel her what is diabetes. It is a silent disorder. You will not have any kind of symptoms. Even though sugars are elevated, you may not have any of the symptoms in the body. You will feel normal as you were feeling before. As sugars are elevated and it is coming in the report, we have to address that. Otherwise it will create silent problems in the future, not today. Immediately you will not have any of the complications. Over the period of 5 years, 10 years, when sugars are persistently elevated, it can lead to heart disease, eye disease, kidney disease. All the complications of body which is reported due to the diabetes can be possible if it is under not under control. And I told her it is okay that this apprehensions, whatever she is having, fear, whatever she is having, everybody, even I'm human being. If I'm a diabetic, I will have certain fear, certain apprehensions, certain risk of getting admitted, risk of getting operated, risk of prolonged admissions, medications, tablets, insulins. Then only she could come to the my conversation. Till now she was having conversation about her fears, about her apprehensions, about her. She was thinking something is wrong. She did wrong diet. She did something wrong. And when I told her, it is nothing about you, something did wrong. In fact, any diabetic patient who walks in doesn't have any wrongdoing per se. It's a natural. When we get old, our body mechanism changes, insulin production decreases, obesity increases, and there is insulin resistance will be there, sensitivity will go down. There is a history of like parents who are diabetic, then there is lack of activity, which we include everything as a holistic. So there is chances of getting diabetes. And if this diabetes is not controlled at par, like whatever suggestions target we set, it can lead to heart disease, kidney disease. So to address like family support, so lot of the patient they say that he is eating too much. I told him not to eat, but they are not getting the point that eating is a biological. It is not that patient wants to eat. Sugar creates a hunger, and uncontrolled diabetes create urinations, and all the sugars will go through outside through the urine, and it triggers the hunger, and this hunger creates a uh, repeated eating. Not all the patients will have these classical symptoms, but many of the patients, maximum patients, will have this kind of classical symptoms. Some patients may have normal hunger, but sugars will be elevated. Some patient may have high sugars, they may not have hunger, but maximum people will have, if they are not under control, they are not taking any kind of medicines, urinations, thirst, hunger, weight loss. These are the classic and sign and symptoms which can be there to the maximum kind of 80-85% of patients. So family support, like reassuring the patient, okay, you are eating well or you are eating more. Let us see the doctor. Directly should not blame the patient that you are eating more. Why you are eating? I told you not to eat. Still you are uncontrollably eating. So we have to get that patient is a diabetic, and with uncontrolled diabetes there will be raised sugar level. Raised sugar will give urination, and with urination body will create a sense, like brain will assess there is a fall in urine level and it creates a hunger. So every diabetic patient may have hunger. So as a family we should support them. We should not blame that you are eating all the time. Some people will say that he is not controlling the diet, doctor. All the time he will eat sweets. So when patient is diagnosed about diabetes, there will be sugar cravings mentally. Everybody will say that you don't eat sugars. The sweets are not allowed for you. Now this creates a negative sentiment inside the brain. In the background, brain thinks that I am deprived of sugars, and you will find it very difficult to go away from the sugars. So that's the reason a patient will have more affinity towards sugars and he just cannot control the sugars. Third factor, like patient's relatives, they say that he doesn't have any exercise schedule, doctor. He doesn't go for walk, he doesn't go for any regular gym. I told many times he just exercise is not working at all. He will just eat, but he doesn't do exercise. As a family support, it is very critical that we have to make them, come to the disciplined work rather than like blaming he's just not doing walking. So support in a such a way that patient should be motivated to do the work. If we directly blame them that he doesn't go to the work, he will never go to the work. He will never go to the walking and jogging and gym or even games. So our approach should be positive. We should be positively induce the person for the positive outcomes rather than through verbally we say that you do not do this and you are bad. For regular checkup, now many of the patients skip the regular checkup, but as a patient support we should always encourage patient, okay, you are taking medications, let's go and see how these medicines are effective or not effective, whether whatever target is set, whether we have achieved that target or not. So these are the basic family support what a patient should get from each and every family members. And I am asking you, are you giving this kind of family support to your near and dear ones? If not, now is the time you start giving, supporting your husband, supporting your wife, supporting your parents, supporting your brother, sister. Ask your brother, you are taking medications or not. When was the last time you did the checkup? Are you following the diet, whatever suggested by doctor? Or your sugars are under control or not? Just you can inquire and see. So any queries you are having about this video, you can just ping me. You can follow my channel, Balaji Diabetes Hospital, Balaji Diabetes Obesity, Medavakam, Chennai. You can schedule an appointment and book for the queries. Anything you can comment and share. Thank you. I'm Dr. Sanjay, Balaji Diabetes Hospital, Medavakam, Chennai.